Hi friends, I am Dr. Gaurav Goel. I am head of neurointervention surgery here at Medanta, the Medicity, Gurgaon. I am sure most of you are not familiar with what a neurointerventionist do. So, neurointerventionist is something like what cardiologist is to the heart, so we are to the brain. So that means we put a lot of stuff inside the brain vessels through the leg, and that's what we have been doing all over the years. I have been practicing neurointervention for now last 12 years, and I was introduced to it when I was in my training in Jaipur, and then I went to Montreal in Canada to get trained further in neurointervention. In last 6 years I have been at Medanta, and we have a very successful neurointervention program running here, and I am glad to be presiding over it. We have a team here which includes 2 fellows and a consultant, and together we take care of all our neurosurgical patients who are suffering from this vascular disorder. Today we're going to talk about how we treat brain aneurysms. So traditionally the brain aneurysms are treated either by open surgery and then putting a surgical clip across the neck of the aneurysm. The other options are to go endovascularly, like through the femoral area, like the cardiologist puncture the artery and we go inside the brain vessels, and then using small platinum coils we put them inside the aneurysm and completely occlude it. And earlier in 1990s this coiling was reserved for patients who were not doing good, as it was in its experimental phase. Now 26 years later I can very confidently say that it has superseded surgical clipping, and we are doing here more of endovascular coiling because we found it's more safe for the patients to have this approach rather than the open surgical approach. And that's what I'm going to demonstrate to you here. If you look here on the screen, this is looking from the front, this is looking from the side. This is the internal carotid artery on the left side. As you can see, the dye is flowing in, and this is this big aneurysm which is sitting on the internal carotid artery, and this is the lateral projection showing this aneurysm in its entirety. This lady has had a bleed and had a big hematoma. So the surgical option would have been to open up her skull, go inside, drill through this clinoid process, and then put a surgical clip across here at the neck of the aneurysm. What we're going to show to you is how we can come from the inside and still treat this aneurysm without doing an open craniotomy. So this is the 3D picture. We always take these 3 kind of 3D pictures, and these are helpful because they can show you the small vessels which are coming from these aneurysms, and once you see them you are able to protect them. We can plan our views and measure them shape and size, and then decide what kind of coil we want to put. Once we have done all this, this is, as you can see, this is a wire, and these wires go inside these brain vessels, and on this wire now what we are introducing is a balloon. So this balloon is going to sit across the neck of the aneurysm, and this will ensure that no such coils come outside into the main artery. Now you can see this is the distal marker of the balloon and the proximal marker of the balloon. So this balloon is now in its position. As you can see, the balloon is now in the position. Now we are bringing this microcatheter in. So microcatheter is nothing but a hollow tube through which we are going to put our platinum coils, and it takes some time to get it in, and this is how it is. So can you see this? Now the balloon is here, and through this tube we have put this platinum coils inside the aneurysm, but it's not done yet because it's just one single coil, and we have to keep filling this aneurysm till it is not filling anymore. So we can still see this black dye going inside the aneurysm, and this probably is the point from where this aneurysm is ruptured. So until unless we close everything, she is not safe. So as you will see, we keep doing this, we keep filling more and more coils till the aneurysm is completely gone, and in the end we take out all the tubes and the catheters, and what is left is this mass of the platinum. And Now we can see the aneurysm is not filling, that leakage spot from the dome is not filling, and everything looks good, including the arteries. So this whole procedure has not taken more than half an hour, 45 minutes, which is unimaginable doing an open surgery. The patient went to the ICU and was sent to the room the very next day, which cannot be possible with open surgical theatre. So we have a very good surgical team here, and Dr. Jha is the chairman of that team, and he only encourages us to do more and more of this endovascular coiling, and this is our preferential treatment.